Hi, my name is Daniela Montonero and I'm going to talk about heparin-induced thrombocytopenia presenting as a bilateral adrenal hemorrhage. Definition: heparin-induced thrombocytopenia is a prothrombotic disorder caused by platelet activating antibodies that recognize platelet factor 4 heparin complexes. Heparin-induced thrombocytopenia is called delayed onset when it begins or worsens after the discontinuation of heparin and spontaneous when there is no apparent proximate heparin exposure. Serum obtained from patients with heparin-induced thrombocytopenia during the acute thrombocytopenic phase of the illness characteristically promotes the activation of platelets even in the absence of heparin.
The term heparin-induced thrombocytopenia can be divided into two parts. Heparin refers to an anticoagulant medication which prevents blood clots from forming, and thrombocytopenia refers to decreased number of thrombocytes or platelets in the blood. So, heparin-induced thrombocytopenia, or HIT, is a complication caused by heparin that results in decreased platelets in the blood. Okay, so imagine you're making dinner and accidentally cut one of your fingers. Now, if your body doesn't stop the bleeding, you'll keep losing blood until there's not enough to supply the vital organs like the heart and brain. Now, to prevent this from happening, the body has a process called hemostasis. This process has two phases: primary and secondary hemostasis. In primary hemostasis, platelets aggregate to form a plug at the site of an injured blood vessel. While these platelets are aggregating, coagulation or secondary hemostasis starts. This is where numerous enzymes that are always floating around in the blood, called clotting factors, get proteolytically activated, meaning that activation happens when a small piece is chopped off, a bit like pulling the pin out of a grenade. These factors activate one another, eventually leading to the activation of fibrin, or factor 1A. That results in a fibrin mesh, which forms around the platelet plug to reinforce it and hold it together. Without primary and secondary hemostasis, our body would suffer massive blood loss from even the most minor injuries. Imagine losing all your blood from something as simple as a pinprick. Okay, so heparin-induced thrombocytopenia is caused by heparin. This medication works by activating an enzyme called antithrombin 3, which inhibits coagulation factors 10A as well as thrombin. This halts secondary hemostasis and prevents existing blood clots from growing larger. So it's often given to people who suffer from pulmonary embolisms, strokes, and myocardial infarctions. Now, the main mechanism behind the development of HIT is actually an
Applications in medicine. These cases illustrate the importance of recognizing adrenal hemorrhage as a clue to heparin-induced thrombocytopenia, and if the condition is bilateral, the risk of adrenal failure. In addition, bilateral adrenal hemorrhage, indicating adrenal vein thrombosis, occur during prophylactic dose oral anticoagulation, further supporting observation that low doses anticoagulation rather than the non-heparin anticoagulant chosen often does not prevent thrombosis associated with heparin-induced thrombocytopenia.
Hey guys, it's Medicosis Perfectionalis, where medicine makes perfect sense, and today we'll talk about heparin-induced thrombocytopenia, or HIT. So, hit me with the facts. As you know, if you have problems with your platelets, it's either a problem in platelet number or a problem with platelet function. In heparin-induced thrombocytopenia, it's a cytopenia. There is a problem with platelet number. It's low. This is the normal platelet count, this is thrombocytopenia, and this is thrombocytosis. Heparin-induced thrombocytopenia is a thrombocytopenia with low platelet count. Is it pseudo-thrombocytopenia or is it true thrombocytopenia? It is true. Pseudo-thrombocytopenia is an artifact in the lab when you put the blood in this purple top tube. Purple top tube or lavender top tube contains EDTA, EDTA will lead to platelet agglutination or clumping. These are 8 platelets, but they are counted as 1 by the stupid butt machine called analyzer. That's why we call it analyzer. It's a stupid butt machine. This is not a true thrombocytopenia. This is a pseudo thrombocytopenia. The machine has been fooled. So if the machine counts 8 as 1, if the patient has a platelet count of 160,000, the machine will count them as 20,000. Thrombocytopenia, is it primary hemostasis problem or a secondary hemostasis? It's a primary hemostasis problem, all of these symptoms. However, don't forget that it's called heparin-induced, and heparin will destroy your secondary hemostasis. So it could be either. More importantly, the most common symptom in HIT is not bleeding. It's actually thrombosis, because anything that can make you clot can make you bleed, and vice versa. How do you treat thrombocytopenia? Treat the underlying cause. If it's heparin-induced thrombocytopenia, maybe you should stop heparin. To achieve blood coagulation, we need many steps: vasoconstriction, primary hemostasis, secondary hemostasis, and fibrinolysis. Heparin will tamper with my secondary hemostasis, and then the thrombocytopenia will affect my primary hemostasis. More importantly, the most common symptom in HIT is not bleeding. It's actually thrombosis. How does heparin work? It stimulates antithrombin 3, and we have talked about this in the previous video. Heparin works by stimulating antithrombin 3. The site of action: blood. Onset is rapid, duration is short, it's always an injection. How do you monitor the unfractionated heparin? PTT. But the PTT cannot monitor the low molecular weight heparin as discussed in the previous video. Here's the unfractionated.
Pros and cons. Pros. Heparin is generally used for anticoagulation for the following condition: atrial fibrillation, cardiopulmonary bypass for the heart surgery, and hemofiltration. Cons: bleeding, hemorrhage, alopecia, osteoporosis, and HIT.
Starts when heparin binds to a protein on the surface of inactivated platelets called platelet factor 4, or PF4. Together, they form a complex called the heparin-PF4 complex. This complex is immunogenic in certain people, meaning they have circulating IgG antibodies that recognize the complex as foreign pathogens. So, these antibodies will bind to the heparin-PF4 complex and mark it for destruction within the spleen. Now, when the antibody binds, it causes the platelet to activate. The activated platelets release procoagulant chemicals like thromboxane A2, or TXA2, which causes other platelets to activate. At the same time, the original platelet will also release more PF4s, so more antibodies will bind and keep it activated. These events lead to more and more platelets getting activated, and they start forming clots throughout the body. This way, a lot of the remaining platelets also get consumed, which results in a low platelet count. It generally takes a week for the body to make IgG antibodies that target the heparin-PF4 complex. Thus, thrombocytopenia typically develops 1 or 2 weeks after starting heparin therapy. The exception is that if heparin is given to someone who was already treated with heparin previously, they would already have the antibodies against the complex, so thrombocytopenia may develop within a day. Now, the widespread formation of abnormal clots can lead to life-threatening thrombotic events, which are most often venous, causing deep vein thrombosis. Sometimes, this thrombus can break down, and part of the thrombus, also known as emboli, can lodge into the pulmonary circulation, leading to pulmonary embolism, which is often life-threatening. Thrombus can also develop in cerebral veins, leading to cerebral venous sinus thrombosis. Compared to the venous thrombosis, arterial thrombosis is less frequent. Arterial thrombosis can block the arteries supplying limbs, causing limb gangrene, or brain, causing stroke, or heart, causing myocardial infarction. Now, the
issue applied in Ecuador. Few cases of HIT-associated BH have been previously described in the literature. Approximately 90% of the patients are post-surgical, with the most common operation being orthopedic. HIT may be an important cause of BAH, accounting for up to 10% of the cases. To our knowledge, this is the first reported case of HIT-associated BAH following partial nephrectomy in particular or urologic surgery in general.
Hey everyone, so this lesson is on heparin-induced thrombocytopenia, or HIT, or HIT. So we're going to talk about what this condition is in this lesson. We're also going to talk about some of the signs and symptoms, how we can diagnose it, and how we can treat it. So heparin-induced thrombocytopenia, we're going to look at the word thrombocytopenia first. So if we break down that word, thrombocyto, the prefix thrombocyto means platelets. Penia simply means low, or a low level of platelets. So thrombocytopenia really means low platelet levels. So heparin-induced thrombocytopenia is a thrombocytopenia occurring after heparin administration. And what we normally see here is that the thrombocytopenia occurs about 7 to 14 days after initiating heparin use. We're going to see that this is not always true, but for the most part, when we're trying to diagnose it, we use these particular numbers. We're going to talk about more about this in detail later on. So it is actually not incredibly rare. It occurs in about 5% of patients exposed to heparin. There's actually two types of HIT, or heparin-induced thrombocytopenia, and we're going to talk about both of those in the next slide. The one we're going to talk about more specifically is caused by production of antibodies to heparin platelet factor 4, or PF4 complex. And what we do find when this happens is that antibody binding causes activation of the coagulation cascade. This can cause many other problems we're going to talk about here as well. So again, as we mentioned before, this condition can occur within 7 to 14 days, and sometimes you might see 5 to 10 days of heparin use, but it can occur sooner if heparin was used previously. So if the person has been exposed to heparin previously, they've developed these antibodies we've talked about. They already have the antibodies there, so it can occur very quickly after a second administration. So it can occur within very short time periods, within hours, if the same person has been exposed to heparin recently. We're going to talk about all those time frames later on in this lesson. So
Conclusion. Finally, the peculiar nature of delayed onset and spontaneous heparin-induced thrombocytopenia, which typically begins several days after the discontinuation of heparin or the inciting orthopedic surgery, poses a risk for misattributing adverse effects to a subsequently administered anticoagulant medication.
Clinically, along with the help of some laboratory tests. For example, individuals who recently started heparin therapy and experience a decrease in platelet count either within 1 to 2 weeks or within a day suggests HIT. The level of platelets can be found by using a complete blood count, or CBC. Other diagnostic tests include an ELISA serological assay to detect the IgG antibodies. However, many individuals that have received heparin previously will have these antibodies, but not all of them will develop HIT, so the test is not very specific. A more specific test is the serotonin release assay, which is the gold standard for diagnosing HIT. In the serotonin release assay, the patient's serum is mixed with heparin and donor platelets. Activated platelets release serotonin. So in a positive test, the patient's serum has antibodies that activate the platelets and the serotonin level will increase. While confirming the diagnosis, it's important to immediately stop giving the patient heparin and to start anticoagulation with a non-heparin anticoagulant, like argatroban, which is a thrombin inhibitor. If the patient has a thrombotic event, anticoagulation is continued for 3 to 6 months. If there was no thrombotic event, then anticoagulation continues until the platelet count normalizes. Alright, as a quick recap, heparin-induced thrombocytopenia, or HIT, is a condition where individuals on heparin therapy develop thrombocytopenia, or a low platelet count in the blood. HIT occurs as a result of an immune response, which ultimately causes the platelets to get activated and used up during the formation of abnormal clots. These clots can block veins and arteries, leading to life-threatening thrombotic events like deep vein thrombosis, pulmonary embolism, cerebral venous sinus thrombosis, and less commonly, limb gangrene, stroke, or myocardial infarction.
Thanks for watching. If you're
Thank you for watching my video, and you can see it in my social media.